Unit 2, Transport Cardiovascular System 2. Chapter 18, pages 657 to 671. Chapter 17, pages 595 to 619. Cardiac output, CO, amount ejected by ventricle in 1 minute. Maximum for trained athletes. Exercising at peak levels. Normal range of cardiac output during heavy exercise. Average resting cardiac output. Some forms of heart failure. Cardiac output. L per minute. 5, 10, 15, 20, 25, 30, 35, 40. Amount ejected by ventricle in 1 minute. Cardiac reserve. With fitness, with disease. HR, 75 beats per minute. SV, 80 milliliters/beat. CO, 6,000 milliliters per minute. Equals X. Cardiac output, CO, factors affecting heart rate, HR. Body temperature. ANS. Hormones. Muscular contractions. Blood volume. Peripheral blood flow. Venous return. Equals SFL. EDV. Influences the efficiency of ESV. Filling time equals ESV. Afterload equals pumping efficiency. And ESV. Vasodilation. Vasoconstriction. Contractility equals ESV. Stroke volume, SFL, equals EDV-ESV. Heart rate, HR. Cardiac output, CO, equals HRX SFL. Factors affecting heart rate, HR. Factors affecting stroke volume, SFL. Heart rate pulse. Infants have HR of 120 bpm or more. Young adult females average 72 to 80 bpm. Young adult males average 64 to 72 bpm. HR rises again in the elderly. Tachycardia. Stress, anxiety, drugs, heart disease or body temp. Bradycardia. In sleep and endurance trained athletes. Bradycardia. Tachycardia. Normal range of resting heart rates. 60 bpm. 100 bpm. Anatomy of blood vessels. Tunica externa. Tunica media. Tunica infima. Endothelium. Smooth muscle. Vein. The structure of the wall of a vein. LMX60. Artery. Tunica interna, repels blood cells and platelets. Simple squamous endothelium overlying a basement membrane. Tunica media, smooth muscle, collagen, elastic tissue. Tunica externa, loose connective tissue. Arteries 3 categories by size: conducting, elastic, arteries. Capillaries. Arterioles. Distributing/muscular arteries. Conducting/elastic arteries. Internal elastic layer. Tunica infima. Tunica media. Tunica externa. Smooth muscle cells. Endothelium. Endothelial cells. Basal lamina. 3 categories by size: conducting, elastic, arteries. Pulmonary, aorta and common carotid. Distributing, muscular, arteries. Brachial, femoral and splenic. Resistance, small, arteries. Arterioles. Veins thinner tunica media 3 categories by size: small veins venules. Large veins. Medium-sized veins. Venules. Capillaries. Basal lamina. Endothelial cells. Pores. Endothelium. Tunica externa. Tunica media. Tunica intima. Thinner tunica media. 3 categories by size. Small veins. Venules. Medium veins. Radial, ulnar veins. Valves prevent backflow. Large veins. Vena cava, pulmonary, jugular. Capillaries, smallest blood vessels. Only vessels that allow exchange of materials. Anatomy. Simple squamous endothelium with basement membrane. Walls, 0.2 to 0.4 micrometers thick, lumen, 5 to 9 micrometers diameter. Filtration predominates. No net. Movement. Reabsorption. Predominates. 24 liters/day. 20.4 liters/day. Arteriole. Venule. Key. CHP, capillary. Hydrostatic pressure. Cup, blood colloid. Osmotic pressure. NFP, net filtration. Pressure. 35. 25. 18. Am. Hg. NFP equals. Plus 10 mm Hg. NFP equals 0. Minus 7 mm Hg. Capillary. CHP greater than cup. CHP equals cup. Cup greater than CHP. Capillary beds meet arterioles, connect arterioles to capillaries. Thoroughfare channel. Connect capillaries to venule. Perfusion. Precapillary sphincter. Types of capillaries: continuous dash, 4 nanometers. Basal lamina. Endothelial cell. Nucleus. Continuous dash, 4 nanometers. Endothelial cells have tight junctions. Fenestrated, 20 to 100 nanometers. Organs that require rapid absorption or filtration. X. Kidneys, small intestine. Sinusoids, 30 to 40 nanometers. Basal lamina. Endothelial cell. Nucleus. Gap between. Adjacent cells. Circulatory routes, most common route. Heart arteries, arterioles, capillaries, venules, veins, heart. Portal system. Hypothalamus, pituitary. In kidneys. Intestines, liver. Anastomoses. Arteriovenous anastomosis. Ears, fingers, toes, palms. Blood pressure, force that blood exerts against a vessel wall. Measured at brachial artery of arm. Systolic pressure and diastolic pressure. Normal value, young adult, 120/75 of a millimeter Hg. Blood pressure, importance of arterial elasticity. Expansion and recoil maintains steady flow of blood throughout cardiac cycle, smooths out pressure fluctuations and stress on small arteries. BP rises with age, arteries less distensible. Blood pressure BP determined by cardiac output, blood volume. Peripheral resistance. Blood viscosity. Vessel length. Vessel radius, vasomotion. Least resistance. Greatest flow. At center. Greatest resistance. Slowest flow near surfaces. Internal surface area equals 2. Internal surface area equals 1. Resistance to flow equals 1. Flow equals 1. Resistance to flow equals 2. Flow equals half. Arteries are common: carotid or subclavian, brachiocephalic trunk. Axillary. Ascending aorta. Brachial. Radial. Ulnar. Femoral. Aortic arch. Descending aorta. Diaphragm. Renal. Common iliac. Arteries. Veins external jugular, internal jugular, subclavian, brachiocephalic. Axillary. Brachial. Radial. Ulnar. Femoral. Superior vena cava. Diaphragm. Inferior vena cava. Renal. Common iliac. Veins, fetal development and circulation. Fetus equals from 8 weeks until birth. Fetal circulation. Umbilical placental circuit. Circulatory shunts. Ductus venosus. Foramen oval. Ductus arteriosus.